Good.
Okay. Hello, good evening. My group is Team 2, and it consists of Michael Livingston, Lauren Cruz, Madison Disordori, and myself, Monica, and we'll be presenting on the paternalistic vaccination public policy against vaccine hesitancy. Our objectives. Can we go to the next slide, please?
Okay.
The objectives for our presentation would be the history of vaccines, the paternalistic vaccination as a public good, ethical orientation of public in vaccination, and public policies on vaccines. And my fellow colleagues will be explaining in more with more information. And now will be Madison.
Okay, so a brief overview of our topic. So the success of vaccinations, according to Kaiser, is infections like polio and smallpox, which were dreaded historically and which devastated the human race over many centuries, are now rare. Smallpox has been eradicated completely, and polio is nearly eradicated because of vaccines. Although proof vaccines promoting health for all, some believe that it actually does the opposite. And according to Hortal, vaccine hesitancy is defined as a delay in acceptance or refusal of vaccines despite the availability of vaccine services. So what are some reasons that someone might be vaccine hesitant? So some of the most common reasons that are seen are a lack of knowledge on vaccines or what they're made of or what they do, religious beliefs, anti-vaccine misinformation that can be spread through the media or even through misleading medical information, and beliefs concerned with vaccine effectiveness of vaccines. Someone might think that natural immunity is just as effective, if not more effective, than immunity that is bolstered by a vaccination. So this brings us to the concept of herd immunity. So what happens if we do not reach it? So what makes vaccines so effective as opposed to just our natural ability to fight disease is a term called herd immunity. Which is defined by the World Health Organization as the indirect protection from an infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. And here we have a infographic on herd immunity that kind of demonstrates how it works in real time. So on the left side, we have no herd immunity, and we have infected individuals passing a disease onto each other and continuing to do so. And then we have anyone who's not infected being susceptible to the disease in question. However, when we have herd immunity achieved, we see that all of the people that were previously infected on the left are now immune through vaccination. And just by association, this protects the people that are susceptible but not immune. So policies that are currently in place. So right now we require certain vaccinations in order to travel to countries where diseases are endemic. They are required in certain healthcare settings in order to have a job in the healthcare field. They are needed in order to attend daycare, school, and college. We have vaccine clinics as of right now. They can either cost money, or we also often have vaccine clinics that are free of charge, as we saw in, for example, something like COVID. And across all fronts, improvements are vastly needed. So my colleague Michael is going to continue to elaborate on this further.
Okay, thank you very much, Madison. It's been a very pleasure working with you. So basically, the proposed policy from our group is that there has to be a nationwide paternalistic policy. It's going to be new in the sense that there's no policy currently in place that is paternalistic. Paternalistic means that we're taking autonomy away from people who are vaccine hesitant and they have to get vaccinated because of the public good, because of the public good of vaccination. They have to be vaccinated so that we have herd immunity, which basically, like my colleague explained, everybody in the community gets to enjoy the protection of the vaccination. So there's a public good, and so we want a national paternalistic policy whereby autonomy is now denied. So it's new, and the policy type is a federal law. Federal law because federal law has federal supremacy over state law. If it's going to be nationwide, like the Constitution of the United States, everybody has to obey it in the public settings. So it's a federal law and it's going to be enforced by the federal Congress. The needs that we need is vaccine preventable diseases. We know in public health 21st century that most of the ground breakthroughs has been vaccine preventable diseases. We want to prevent the disease from happening instead of curing the disease. And that's what we do in public health, prevention. So hospitals will have the authority to implement after Congress has already promulgated the rules and the policy into existence. And the LHDs, which is the local health departments, would also implement it at the state level and at the municipal level. And that will help to make sure that it is paternalistic. The resources that will be invested into this policy implementation, this new policy is grants for LHDs because most of the public health impact and vaccinations happen at LHDs. So most LHDs under the CHIP program will be required to receive these grants and make sure that everybody is getting vaccinated mandatorily through state appropriations. And also we're going to work with the stakeholder community, the stakeholder communities that are internal, external, and ambivalent stakeholders, because in public health, we engage a lot of stakeholders. The stakeholders are the public. We will try to campaign with the public, do health communication campaigns with health belief models, motivation intervention strategies to evoke change for them to realize that those who are vaccine hesitant need to change that behavior and accept and become vaccine confident. So we're also going to use the existing models that are existent as we learned in this class, drafting effective policies. Community change framework, that's what we're going to use. And that means that we are doing community. The community here is the nation. The community here is the state. The community here are people who are vaccine hesitant. The next thing that we will do is implementation. We will have a full-blown implementation from national to state level, municipal levels. We will use the model that was provided by Thomas Frieden, CDC director, in 2014. He lists these steps: that innovation, it has to be something new, something disruptive, something creative. And this definitely is something new because now we are going past the ethical imperative of autonomy to paternalism. So that's innovative. There's never been anything like that. And the second thing is evidence-based. It has to be evidence-based. In public health, we do evidence-based interventions, not emotion-based interventions. So here, for example, as we have soda taxes, taxes on soda to prevent people from drinking soda with that sugar. Cigarette taxes, it's worked. So similarly, we will have evidence-based intervention whereby we will require people to pay more taxes if they refuse to receive a vaccine. And that will be an incentive or a trade-off. We will also have effective program management so that we know that the implementation is effective. We will do partnerships. In public health, we have partnerships. We partner with hospitals. We partner with universities. We partner with local law enforcement to make sure that there's a task force going around and checking to make sure that people are vaccinated and they have a slip in their wallet or anywhere to show, like government IDs, to show that they are actually vaccinated. So communication will be key. And the political setup will also be key. Political leadership, we will work with the political leaders, the governors, the legislators, the senators, to make sure that they are all embracing paternalistic vaccination so that everybody involved know that it is enforced and they have to become vaccine confident in the vaccines to prevent disease. So my colleague will now highlight more about some of the current issues in New Jersey that will be intervened with this vaccine paternalism.
Thank you, Michael. So yeah, this next section is going to be focused on a vulnerable population being children. Children are a vulnerable population that need certain vaccines at a young age, and vaccination rates have been known to become lower and lower due to vaccine hesitancy. So for a paternalistic aspect, strengthening requirements for children in school settings is essential in regards to policy. So for current policy in New Jersey, schools and daycare facilities are audited every year by local health departments. Children, depending on which grade and age, are required to have certain vaccinations before starting school at the beginning of the year. They're not supposed to be allowed to be at school unless they have these vaccinations because of the importance of what we discussed before of herd immunity. And the issue being is that many do not follow the rules. Some nurses and principals do not exclude, and therefore herd immunity is not achieved, and this results in children and staff putting their health at risk. Next slide, please. So how can we strengthen this policy? So like I said, it's supposed to be that they're not supposed to attend school unless they have their vaccinations, but because not everybody follows this rule, we need to make the rules more strict. Unfortunately, without any type of consequence, change will not occur. Another example is just if you are somebody that speeds on the parkway, you need a speeding ticket, and to pay the price for that to learn to not do it again. So instead of schools abiding by exclusion, it should be required to have all students not attend school until they have received their required vaccines. Nurses and daycare directors have compliance rates, it's called, which is essentially just reaching the ultimate herd immunity for these certain grades. And they must meet this in order to pass their audit. At this point, there are no consequences if you fail the audit, or you also have 30 days to submit any updated records to the local health department. And if you don't pass, they do threaten to fine, which I will talk about in a couple later slides. But they have not actually advocated for that. It's like a threat that they don't follow. And there's also a decrease in the amount of vaccinations due to religious exemptions. We've been accepting a lot of religious exemptions, and they're not valid. They're just using it as an excuse to not get vaccinated, and obviously that's an issue. So there should be a stricter policy on not accepting, religious exemptions or certain exemptions. Next slide. So we also need to prioritize proper education to parents on the importance of vaccines, because this is where vaccine hesitancy and why there's such low vaccination rates all stem from. And there are some problems with, the public and parents not trusting governmental agencies right now. So putting a policy in regards to doctors should be required. Doctors should be required to discuss and educate and answer any questions surrounding vaccine hesitancy in parents to help, achieve that vaccine confidence. And parents are more likely, like I said, to trust the opinion of a pediatrician as opposed to a governmental agency. So if we stronger enforce medical providers to educate the importance of vaccines, it will therefore reduce the amount of parents who are vaccine hesitant. And the decision makers in this policy, the New Jersey Department of Health have the power to strengthen policies regarding schools and daycares, like I said, being fined for not passing immunization audits, and also being in consequences for children not being excluded when they don't have the required vaccinations before starting the school year. And the resources needed, so like I said, the local and state health department is ultimately making those bigger decisions, but the local health department is who's going and recording the data that we are collecting in regards to those that are getting vaccinated. And we also can use a surveillance source called NJISS, which is another way that we can monitor who's receiving vaccines. It's essentially a database that shows a lot of most people in New Jersey and what vaccinations they have received. So that's a digital aspect of a resource where we can monitor, what our vaccine rates are. And then immunization audits at local health departments are performed. This is the example of the physical materials. People at the local health departments are actually going out into the field and recording and looking at these records and making sure that, the kids have what they need, and that also the nurses and the daycare directors' records are in order and clean, and heaven forbid there's an outbreak, they can see who doesn't have these vaccines and who needs to be excluded and who is at great risk of, getting ill. Okay, and I'm going to pass it back.
Oh, I noticed that I was muted. Thank you, Lauren. So in this slide, we're going to be discussing stakeholders, specifically stakeholders that would be involved in the development and implementation of our policy. So this would include government healthcare workers and researchers. The public has access to national data on health, but obviously government healthcare data is more easily accessible to the healthcare workers and researchers who know how to interpret it. There are many different areas of expertise within government healthcare workers, and there's also a connection to the government in a way that they can advocate for the ratification of this policy into law. Local, state, and national healthcare workers, they have firsthand experience in treating those who do not get vaccinated. They may also have further insight into local and cultural barriers to treatment and how to work around them. And then lawmakers / the Department of Health, schools, pediatrician's office, pretty much anywhere that would mandate this kind of policy. This is a direct point of contact for people who would need education on the importance of vaccination, as well as the source of implementation. So of course, a process like this would go a whole lot smoother if the general public was fully educated on the importance of vaccinations, not just being forced into it blindly. So it definitely would take a collective effort from the government and healthcare educators as a whole. So. And then as far as support, so there's many different areas that could be stakeholders as far as support for our policy. Again, government health agencies are a good example because they are better able to predict, trace, and control outbreaks with higher rates of vaccinations. Local healthcare workers, they are now safer in the workplace if they are to follow our policy, and it's easier to vaccinate than to treat previously eradicated diseases. So as we said, obviously earlier, public health is all about prevention. And this also ties in with the government because prevention is also significantly cheaper than a secondary treatment or a tertiary treatment of some kind. So it's far easier to vaccinate than to treat an outbreak or a pandemic. Again, COVID is a great example of that and the way that the outbreak affected our economy as a whole. So public school workers are safer in the workplace. The children who attend school and just are in the general public at large are also going to be safer. And it is in the best interest of the public to participate in vaccinations because, as we discussed, as far as herd immunity, the majority of people are going to be protected by this. So I will be passing it on. I'll be passing it back to Lauren, I believe.
Okay, so yeah, to further elaborate on existing policies, examples, so the World Health Organization proposed the Global Vaccine Action Plan from 2011 to 2020 to promote essential or routine vaccinations among all children of the world. And then also from a state level, this is a section from the New Jersey Department of Health frequently asked questions. I'm able to get the inside scoop as someone that does audit in Ocean County. A lot of the times I get questions from nurses and they don't pass their audit and they're like, well, what happens now? And this is what the state does have that they include, and this is the New Jersey immunization regulations apply to children attending any public or private school, child care center, nursery school, preschool, or kindergarten in New Jersey. And the principal, administrator, or person in charge of the school shall not knowingly admit or retain any child whose parents have not submitted acceptable evidence of immunizations, unless, however, they have a valid exemption. Failure to do so would be a violation of the state sanitary code, and the school may be, they say, subject to a fine. The statute stipulates that each violation of any provision of the state sanitary code shall constitute a separate offense and shall be punishable by a penalty of not less than $50 nor more than $1,000. So this is just very interesting. Personally, no one that I've seen in my workplace has ever had this, but it is in their policy, but they don't actually act on it. And if this was acted on, the nurses would take this more seriously and they would much more likely care about their compliance rate. So I just wanted to include that. And then an example of policies that can aid in policy implementation, Supreme Court's Jacobson versus Massachusetts in 1905, the government is granted the responsibility of protecting the public from diseases with the potential to spread rapidly with significant threat to public health and well-being. And this can be done from quarantines or compulsory vaccinations, and even fine those who disobey these mandates, which we, just reiterating that we've discussed previous in the presentation as well. And then unfortunately, there is going to be ethics. I think we've seen a lot, since the COVID pandemic, especially. The fear of vaccines, and that's due to lack of education, but limitations to these strict policies would be that there would be some backlash. There would be people that are upset, that are passionate about this topic, that they still fact for that they want to advocate for the my body, my choice. They feel they don't like that government agencies should be telling what they can and can't put in their body. But making these requirements and policies, like I said, may make these certain individuals feel uneasy, not having personal autonomy over their body or their children's body. But we can avoid this by implementing proper health education and debunking those myths that we have put out through like social media and everywhere, that people are believing this can help from like that ethical standpoint, and once people are properly educated on the importance of vaccines. So policy-making process of a public health professional. Health policy is essential because we need rules and structure in order to maintain good health for all. Unfortunately, like I said, everyone's different. Everyone has their own opinions. So it is important to have some structure. Like I said, if we wouldn't have structure like this, then we can lead ourselves down a wrong path of reintroducing and resurgencies of these vaccine preventable diseases, and we don't want that. It is especially important when it comes to communicable diseases, since herd immunity only works when a large portion of the population is vaccinated, which is why vaccine coverage is so important. And policy helps communities cooperate and receive certain vaccines. And then I just wanted to say, being able to work at a local health department who audits, in my personal experience, I've seen that the schools that do follow the exclusion rule and fear getting fined by these states have very, very high vaccination rates. It works, and that's why it should be implemented as a required health policy. And people should follow these recommendations, without having to do this, but unfortunately, it does need to happen in order for this to get done.
Okay. That was very good, my colleagues. You did very well for Team 2. This is the end of our presentation, and everybody has highlighted the importance of vaccine so we can get vaccine confident. Thank you very much for listening to us. What questions do you have? Let us know. Thank you. And these are our references.